It's tips time. Welcome to Training Intervention Program for Behavior Change. I am your psychologist and behavior specialist, Geraldine Garwood. Please remember to subscribe to this channel. Don't forget to click the notification bell so that you can know when a video is uploaded. Today we're going to be talking about behavior therapy for ADHD. This is a follow-up video to my PowerPoint video on ADHD so that parents and educators can understand the DSM criteria for diagnosing a child with ADHD. So I want to talk to us a little bit about behavior modification therapy for ADHD. And there are several therapies, and I'm going to mention a few because I'm going to be doing this video in stages. So the first thing is, of course, having a diagnosis that your child has ADHD. And to remind those of us again what ADHD is, it is attention deficit hyperactivity disorder. And so we find that a number of our students or a number of children are diagnosed with this disorder, and educators and parents are frustrated because they do not know how to treat with the disorder or how to cope with children who have such a diagnosis. And so my job is to help you a little bit how you can work with a child with this diagnosis. So first thing is that you will take the child to see a behavior therapy. Most of the times, children with ADHD are given medication like risperidone or risperidone. While medication is useful, I believe and I'm an advocate for behavior modification therapy because we know the side effects that come with medications. And I am not here to argue against the use of medication, but I would like our parents to embark on the whole behavior modification process and even to supplement that with mild medication so that your child can function. You know the side effect of medication. The medications allow the children to be lethargic, to be very robotic. Also, it changed their odor for some of them. They have a bad breath. They are spaced out, days out. And so one of the things too is that when the medication is not being given on a consistent basis, then they can display some kind of irritability and erratic behavior as well. So because it may be difficult for teachers to monitor all of these children taking medications to school, it would be best suited that a behavior modification program is in place in the school system and parents also at home so that children can cope with this disorder. So the first thing having a diagnosis and you go to the behavior therapist is that you are going to put the child on a behavior program that facilitates replacement behaviors. So what we do as behavior therapists is that we put we look at the triggering behaviors that the child is displaying, or what we would describe as the social significant behavior that is impairing the child's functioning. And then we look at a replacement behavior that is incompatible to that behavior or is an alternative to that behavior that would be a required behavior or an appropriate behavior. And we're going to be training the child in the displaying of this behavior. And while we're training the child, we're going to be using a lot of reinforcement, positive reinforcement and negative reinforcement, so that we can get the child to be shaped in those behaviors. Another method that we would use as behavior specialists is what we call shaping procedures. So what we will do, we will successively shape the child um, to display the appropriate behaviors that the parents and the school requires of the child. But most importantly is parent training. Without parent training, it is going to be difficult for the child to maintain the appropriate behaviors taught. One of the things is that parents have to support any form of behavior modification program that is in place for your child. Because what you want is consistency. So even if the school has a behavior modification program in place for your child, if you are not a part of that intervention process, then the program will not work effectively. What you want is that the school and the home is on the same page as it relates to behavior modification. So it is very important that our parents are trained in the process. And stay tuned for another upcoming video where I will be providing a training session for parents with children diagnosed with ADHD so that we can understand some of the, the interventions that are there so to help your children. Your children need a lot of support once they have this diagnosis. And so, as indicated, you can't allow your child to know how frustrated you may be, but you must allow them to know that I am here for you and I am going to support you in whatever you're doing. You can't allow the child to feel out of place or to feel inferior to other children because they have this diagnosis. And oftentimes, these students or these children are stigmatized. And so, we don't want that any at all. We don't want the children to be stigmatized either at school, in their community, or in their home. So, we want you to treat your child as normal within their disability. And somebody will maybe wonder what is normal within a disability, but I believe that every child is normal within whatever disability they are having, and so you will treat them as such. So you are not going to let them feel out of place. You're not going to let them feel different. You're not going to let them feel inferior, but you're going to give them the normal treatment that they deserve. So you're going to put everything in place for them so that they can function to the best of their ability. So a child with ADHD can function within the deficit of ADHD and can function well and can achieve academically and can achieve from a skill approach. And so I am recommending that you treat the child as normal as possible. Also in the school setting, I am recommending that the teachers desist from allowing labels to be attached to these children. What you find in the school setting is that there may be breach of confidentiality. Once a child has a diagnosis, that is between the educator, the parent, and the child. Also, you can sensitize. So a teacher may ask, what if other children sense that this child is not functioning as them? One thing you can do is sensitize the class to the fact that everybody functions differently. And so, what we do is that we are going to be supporting each other based on how they function. So, yes, children can pick up that a child may be slower or a child may display some behaviors that are out of place or are not acceptable at school, right? Display behaviors that they may begin to wonder if something is happening with their peer. And one thing that we need to be skilled at in the classroom context as educators is how do we sensitize the other children about children that have diagnosis. We can do so without telling them the diagnosis of the child. So we can simply say to them, we are in this learning space. We have children who are at different levels. Everybody will function differently. What we want to do is respect each other, care for each other, and help and support each other, right? And you can even say, you may see some of your peers doing this, doing that, doing a behavior that is not acceptable in the class. They may say something that is not acceptable. And so, what we are here to do together as a class, we are here to help each other to learn and to do the correct thing. And so, when children learn and understand that they need to be sensitive towards each other, then we will have a good operating, a well managed classroom, because they will know that my duty here is to extend help, is to extend support to my peer. So therefore there will be less stigma attached to that child. And so the other children will learn how to care more for children with deficits without having knowing the detail of what is happening to that child. And so I want to encourage educators to create a classroom climate, create that culture where children with ADHD feel welcome, where there is no stigma attached to them and their diagnosis, where their peers are aware and alert as to how they can help them to function within the classroom context. So, behavior therapy is what I recommend for children with ADHD, where they can learn replacement behaviors for their inappropriate behaviors. And so we use differential reinforcement of incompatible behaviors or differential reinforcement of alternative behaviors. That is a procedure that we use to help these children to function. And I want you to stay tuned to my upcoming video where I am going to be doing a series of how we use the DRO procedures to help children with ADHD. So as indicated earlier, this is a follow-up video to a PowerPoint video on a DSM diagnosis of a child with ADHD. And I want us to be clear that children with ADHD can function and can function at the highest level. Children with ADHD can function with behavior therapy without medication. Some children may need to function with behavior therapy supplemented by medication, and that is fine. As stated earlier, let us not resort to medication only, because that has many side effects that can impair our children and their functioning as well. Thank you for subscribing to my channel, and I hope that you learn something today. Stay tuned for the upcoming video that will follow on the DRO procedures to help children with ADHD. That's it for tips for behavior change for today.